Medical Cannabis, Scientific Evidence. Learn about the National Academies of Sciences, Engineering, and Medicine. Scientific evidence on treating various cases, both physical illness and mental illness. Medical doctor, professor, co-founder of Medicann IPS Medical Cannabis Clinics in Colombia. From Colombia and Panama, Dr. Sandra Carrillo.
Hello, everybody. I am Dr. Sandra Carrillo. I am very pleased to be here. This is a very exciting moment. Thank you for inviting me. This is a great opportunity. I am from Latin America. I was born in Colombia, and I live between Colombia and Panama. I am a professor of the Faculty of Medicine, University of Panama. I am in charge of the scientific program of medical cannabis. In Colombia, I am the president of the Colombian Association of Medical Cannabis. We are a nonprofit association, and we are dedicated to promote education based in scientific evidence. I am a board member of the Association for Cannabis Specialists. I am a scientific board of the Medical Cannabis, Portugal Medical Cannabis, and I am scientific board of the Colombian Observatory of Medical Cannabis. I have a master's in health services management, and I am a co-founder of Medicann IPS, Medical Cannabis Clinics in Colombia. I am a member of different cannabinoids association, and I am a review board member of the American Journal of Endocannabinoid Medicine. As I said to you, I am a co-founder of Medical Cannabis Clinics. As may you know, Colombia legalized medical cannabis 4 years ago. So the industry and the science and the doctors are every day moving forward to create more scientific-based evidence for the patients and creating new developments. I would like to talk first about the timeline of medical cannabis. This is very important because sometimes people talk about saying that medical cannabis is something new. In here, I can tell you that this is a medicine that is being used for many, many years. We have in here in this timeline that is being used even 2,700 years before Christ, was used in Chinese medicine, was used in Hindu medicine. Even in the year 207 after Christ, the founder of Chinese surgery was using it as a mixture with wine and cannabis to do anesthetics for the patients before surgery. We have in the year 10,000 after Christ, a very famous physician, Avicenna, he created the canon of medicine at Avicenna, where you see that the cannabis was listed as a very important medication for treating different pathologies. We have in 1839, Dr. William O'Shaughnessy, he brought medical cannabis to the Western countries. He observed in India and in Asia how cannabis was widely used for treating different pathologies. And then we have in 1937, the prohibition. I'm going to talk about that later. We have another very important discovery. In 1964, Professor Raphael Mechoulam discovered the structure of the delta-9 tetrahydrocannabinol, THC. And then we have in 1988, Professors Eileen Howlett and William Devane, they discovered the CB1 receptor. Then we have how in 2011, the Israeli cabinet approved medical cannabis for research purposes. And here we have then the approval of medical cannabis, legalized medical cannabis in Canada. So we see in here so many countries after 2016 that are being legalized in medical cannabis. And this is very impressive to see this global trend all over the world. I am very excited to see that Thailand has regulations regarding to medical cannabis. I had the opportunity to visit Thailand, and I loved the country. I love the people, and I think medical cannabis is a great alternative for the patients. So I can show you in here a little bit about the prohibition. As I said to you, medical cannabis at the mid of the 18,000 was sold over the counter, and we will see different presentation. And by the 20th century, we used to have more than 100 papers about cannabis were published in the Western medical journals. So it was in 1937 that Harry Ashlinger, that it was the appointed director of Federal Bureau of Narcotics, decided to do the prohibition. And after that, we started that era where medical cannabis couldn't be used anymore. I had the opportunity to meet in Israel Professor Raphael Meshulam, very smart guy. By the way, he just turned 90 years old and is still very sharp and very kind person. Important to walk you through a little bit. I know a lot of our colleagues have talked already about how cannabis works. We know we have endocannabinoids, we have phytocannabinoids and synthetic cannabinoids. So endocannabinoids are the molecules that our own body produce. We know the most popular ones are anandamide and 2-AG. And we have also phytocannabinoids, THC, CBD, they are the plant derivatives. And we have the synthetic cannabinoids like the marinol and another different types. All these endocannabinoids, phytocannabinoids, and synthetic cannabinoids, they bind to receptors that we have in our brain and in the rest of our body. So endocannabinoid system is in charge to have the body in homeostasis, to keep the balance in the body. It's in charge to sleep, protect, and it has many other functions. It helps to eat, to repair, to forget. We here see how the phytocannabinoids interact in so many levels in the body. We see in here interactions, just we see here CBD interacts in different receptors, TRBPs, PPARs, 5-HT, and we see the other cannabinoids, THCB, CBG, each of one of them, they go to a different receptor. This is a very complex plant, and it's amazing the benefits that offers to treat certain pathologies, but because of the complexity of the interactions in the body, is that we need to be cautious and careful. And what I always say as a physician, I recommend that always when a patient wants to use the alternative of medical cannabis, has to be always monitored and supervised and treated by a doctor. We know that the plant is complex, as I said, has cannabinoids, terpenes, and flavonoids. Are being discovered already more than 140 cannabinoids, more than 100 terpenes and flavonoids. So it's because of all these interactions is that the treatments with medical cannabis are effective for many different pathologies. I'm going to give you a very short briefing about the human endocannabinoid system. This will be a conversation for hours, but I'm just going to give you a small brief about the endocannabinoid system. And we know that the endocannabinoid system is composed by the endocannabinoids. They are the anandamide and the 2-AG that our own body produce. And we have the endocannabinoid receptors such as CB1, CB2, but we also have more receptors that are being discovered. CB1, we know they are predominantly distributed in the central nervous system, and the CB2 are widely distributed in peripheral organs. And we can see how the phytocannabinoids like the THC fit perfectly into the receptors like the CB1 in an important way, like the way that a key fits in a lock. It's very important to know that the endocannabinoid system controls pain, appetite, sensation, inflammation, mood, energy, metabolism, and we need to consider they have different effects on the central nervous system, gastrointestinal system, hormones, bones, immune system, metabolism. And it's because of this that we have this graphic showing how all these receptors, CB1 and CB2, are distributed in different organs. As I was telling you, the receptors are coupled to ligands. The ligands are anandamide and 2-AG, and they act in the presynaptic and postsynaptic neuron in a very interesting fashion. They usually act in a retrograde fashion. Usually, the way the synaptic and presynaptic transmission occurs in an opposite way, but with the endocannabinoid system, we have the endocannabinoids are produced on demand, and then they are released on the synaptic space and linked to the receptors CB1, producing different reactions in the presynaptic neuron. This is a small talk about endocannabinoid system. Of course, this is a very, very wide subject that I am a professor of the Faculty of Medicine. And when I teach about endocannabinoid system, this takes hours and hours. The subject of my conversation today is talking about scientific evidence. This is for me a very important topic because when I face lectures and classes and when I need to talk to regulators and doctors, this is the most important thing because it's the scientific evidence, the one who's backing up the use of medical cannabis for the treatment of different patients. So for me, when sometimes you have doctors and healthcare practitioners to come and say that they don't believe in medical cannabis because there is not enough scientific evidence, we can debate that. Not meaning that we have all the scientific evidence. We still need to build a lot of good quality studies, but we do have already studies. We have countries like Israel, Canada, Europe, United States, that they've been building a lot of research for many years. So I will show you this here, talking about importance of scientific evidence. We have the systematic reviews and randomized controlled trials are on the top of the pyramid. It means that they are the ones that have the highest scientific evidence value. There have been done different reviews in different continents and countries regarding to the information and scientific evidence we have regarding to the use of cannabis and cannabinoids in health. This is a review that they did Health Canada, and it was a very thoroughly review. I'm not going to talk about that right now for a matter of time. This is another one done by the European Monitoring Center for Drugs and Drug Addiction, and it was done a lot for policy making, but it was very complete too. Today, I'm going to talk about this review. The past two reviews that I showed you, the European and Canadian, were done in 2018. This that I'm going to present was done in 2017, and it was done by the National Academies of Science, Engineering, and Medicine. And they did a systematic review and reviews of almost 20,000 articles. And they choose of all articles, which ones were the one who had better scientific evidence. And what they had as a conclusion is that there is conclusive of substantial evidence, the use of cannabinoids in chronic pain in adults, as an antiemetic for treatment of nausea and vomiting induced by chemotherapy, refractory epilepsy in pediatric populations, and improving spasticity symptoms in multiple sclerosis. We have moderate evidence, limited evidence, and no evidence. Remember, this report was done in 2017, even for refractory epilepsy in pediatric populations. The most important evidence was released after 2017. So I put it in this diagram because I consider that right now we have conclusive and substantial evidence about treatment of refractory epilepsy. As I said, because this was done in 2017, all these other pathologies that we're seeing with moderate evidence, limited evidence, and no evidence, I think they're going to be moving faster because of, thank you to the legalization of medical cannabis in different countries, I see a big trend and doing more research all over the world. I will be talking about important studies that have been done in the pathologies that we know we have more scientific evidence. This was a study made in Ljubljana. It was a study with 66 patients. They want to demonstrate the effectiveness of CBD as an adjunctive treatment of epilepsy. They showed the reduction of seizures on the patients, and they were given 8 milligrams per kilogram a day. And they showed that 80% improved more than 50%. So we're seeing here a very important result. This is another study that it was done at the Sick Children's Hospital. This study was an open label prospective study, 60 patients, and they want to demonstrate efficacy and safety of CBD in a combination of C50 to 1 CBD and THC. And they wanted to prove the secondary objective, the reduction of the number of seizures and changes of the electroencephalogram. We see in here that these patients really had a very good response, and the number of seizures, the reduction was very important. They just found side effects like somnolence, diarrhea, and anorexia, and an increase on transaminases. This is very important because people have been talking about CBD and liver function. So in these patients specifically that they saw elevation of transaminases was the patients that they were taking valproic acid. So we have to see the concomitant use of the other anti-epileptic medications with the CBD. So that means that the neurologists need to be aware of this and control the doses and the levels. This is a very famous study. It was published by the New England Journal of Medicine. Medicine was a very well done study. It was double-blind, randomized, controlled placebo study, 120 children. They gave doses of cannabidiol, even up to 20 milligrams per kilogram per day. And to the other group, they gave them placebo. And the important thing in here is they saw that the decrease of the seizures in these patients in 14 weeks was from 12 to 5 in the CBD group, and from 14.9 to 14.1 in
society, ceaselessly strengthening and enhancing wisdom.
Evidence in here that the cannabidiol is a very good alternative for treating these patients with Dravet syndrome. They found side effects, the same diarrhea, vomiting, fatigue, but not serious side effects that they make the children or the families to withdraw the treatments. We have in here another multiple number of studies that have been done. I'm not going to go all the way there. We have here scientific evidence of multiple sclerosis. We have this study. It was a total of 386 patients with different neurological conditions, and they showed that the combination THC-CBD, and in this case Sativex, significantly reduced neuropathic pain, spasticity, and muscle spasms, with some side effects like sleepiness, fatigue, and some of them feeling of intoxication. I have another study here, again, a randomized double-blind controlled study proving that medical cannabis preparations were very useful for patients with multiple spasticity and sclerosis multiply. Another study here. Now we're moving to nausea and vomiting induced by chemotherapy. This is another study. It was a study who was showing how the treatment of nausea induced by and vomiting induced by chemotherapy was showing result when the antiemetic therapies was in combination with cannabis. This was a pilot randomized double-blind placebo-controlled phase 2 clinical trial. And the conclusion was that compared with placebo, the cannabis-based medicine added to the standard anti-emetic therapy was well tolerated and provided better protection against delayed nausea and vomiting induced by chemotherapy. We have another study that they did in here trying to see how cannabidiol helps these patients too. Talking about cancer-related pain, we have this study of the Journal of Pain and Symptom Management. Again, double-blind, randomized placebo-controlled study showing that 177 patients, 30% of these patients achieve pain relief with a combination of CBD and THC, different than the ones that use placebo. I have other studies in here in 2018 showing also that the patient in the scale of pain started the study with 8 or 9, and the reduction at 6 months were very impressive. Other study done in Israel with a whole plant cannabis from Israeli dispensaries showed how the use of this cannabis plant improved nausea, vomiting, mood disorders, weight loss, and anorexia in patients with cancer-related pain. This is a very important improvement in here. The Canadian Pain Society guidelines moved the cannabinoids from the 4th line agents to 3rd line agents. This is very important because we are seeing in here how cannabinoids are moving up into the manage of pain. We have other studies in here for rheumatoid arthritis and for fibromyalgia, proving the cannabinoids like Sativex versus placebo. The patients with Sativex had a statistically significant improvement. And in this other study with fibromyalgia, they used Nabilon, that is a synthetic, but they showed that the group with Nabilon improved a lot. This is a systematic review that it was released 3 months ago. In this study, they show it was 9 studies involving 7,000 participants. And the important thing is they show the 75 reduction in opioid doses were used in combination with medical cannabis. So this tells us that for patients with not cancer chronic pain, the use of medical cannabis helps to reduce the doses of opioids, which is very important. We have in here the CDC in 2017 reported that 47,000 deaths due to opioids. And the medical cannabis states, the legalized medical cannabis, 25% have less opioid deaths. So we have in different studies in here that the patients reported substituting opioids 35%. And in other studies, 14% reported substituting anxiolytics and benzodiazepines. And here in this diagram, we see how patients they are preferring to use non-opioid based medications. They rather to use cannabis instead of non-opioid based medications. We see in here how 60% of these patients prefer to use cannabis instead of non-opioid based medications. So we have to be very careful in a consultation because we have special risk populations, patients with pregnancy and breastfeeding, patients with a history of substance abuse, and patients with psychosis or schizophrenia. Those are populations that they are high risk, and as doctors, we need to assess when they come to our consultation if they will benefit from these treatments or not. Also, another special risk populations are patients with unstable cardiac or lung conditions, and also children and adolescents. We are in a very interesting area now, and is that we are all over the world. I see scientists and doctors moving forward to start conducting more research with cannabis. We have a lot of barriers. One of those is the classification of cannabis as Schedule 1. And it's also very hard to gain access to quantity and quality of the type of cannabis product that we need to address a specific specific research questions. So it is very important to improve and standardize the research methodology so we can have proper studies and better numbers of samples of patients. As I said to you, I think we do have scientific evidence. So when somebody comes and say medical cannabis is not supported by scientific evidence, I just showed you in a very fast way that we have well done randomized placebo-controlled studies. There are the gold standards, of course. It doesn't mean that we don't need more studies. I encourage scientists and doctors all over the world to gather the data, to keep doing research, and to see for more different type of treatments and pathologies, because as a doctor, my duty is to help patients. And if we doctors, we are open to the knowledge, open to learn about the endocannabinoid system, we can help those patients that haven't found any response in other treatments. I will leave you with this phrase that I like a lot. Nothing in life should be feared, only understood. Now is the time to understand more and fear less. Thank you so much for this invitation. I am very excited to see this global trend of medical cannabis education. Thank you for this initiative. My main goal is education, because if we educate doctors and healthcare practitioners, they will feel more confident about prescribing and recommending medical cannabis, and the patients will obtain a huge benefit of these treatments when they are done with a protocol and with a follow-up and with a doctor monitoring them. Thank you so much.
Thank you so much, Ms. Carrillo. We have one question from one of our attendees regarding migraines. We know that you've been talking about the medical benefits for pain reduction. Does that also apply to migraine-related pain? Oh, she can't remember. She can't.
Do we have any questions?
Remember, she can't hear us. Oh, yeah. Hi.
Yes? So do you have any questions?
Can she see our chat?
I don't think she's noticing the chat.
So why can't she hear us?
I cannot hear you.
Start video, let's see.
I think now you can hear me?
We can hear you, yes.
Perfect, now I can hear you. Great.
Oh, okay, wow, okay, excellent. So let me ask you the question again. We know that you covered a lot about pain relief, especially related to cancer and other neurological diseases. However, we have a specific question about pain relief associated with migraines and headaches. Is it similarly applicable, cannabis?
Yes, definitely. We are actually, I've read a few studies. Still, we don't have like a randomized controlled placebo study regarding to this subject, but in the practice, we see an important improvement of these patients when they're taking cannabinoids. They have to be, of course, properly diagnosed, but yes, definitely the patients with migraine benefit incredibly with cannabinoid therapies.
Wonderful. Thank you so much for your excellent presentation, and we look forward to hearing more from you in our upcoming discussion.
Thank you so much.
Thank you so much, Ms. Carrillo.
Bye.
Bye-bye.